I know it feels like forever, but in reality, it's only been 9 days since my facelift. And today I'm going to show you exactly what healing looks like. We're going to talk about what my doctor has told me, and we're going to discuss what kind of laser treatments might be safe. I'm going to answer this question once and for all. Now, this is a very real and vulnerable part of my journey that I'm making this video to document. So let's get started. Today is day 9 post-op. So at this point, the swelling is significantly decreased compared to how it was around days 3 and 4. I still have some staples and stitches in, which will come out on day 13. And overall, I feel pretty good. I'm sleeping better. I'm eating better. I'm walking more. But when it comes to the scars, well, the jury is still out. In this selfie, I've got some tricks to reduce the reflection and glare. But even so, the scars look a bit funky. They look raised, tight, or slightly sunken in a few spots. Now, believe me when I tell you, this is totally normal. Dr. Yoon has explained this to me, and other patients have confirmed this as well. At this stage, the scars just need to breathe. They need time to reorganize their collagen fibers and remodel. This phase usually lasts for about 1 month. After that, the scars should start looking better. As I mentioned, my scars are still very fresh. Some are raised, some look a bit contracted, and a few feel slightly depressed. It's important to remember that each person's healing journey is unique. Just because my scars aren't looking perfect doesn't mean yours shouldn't. And vice versa. We all heal differently. So let's keep things in perspective. If you're feeling down about the state of your scars, know that healing is messy. It's slow. And it's normal for scars to look worse before they get better. Hang in there, because every day brings us closer to that final healed result. The hardest part for me is that I don't even recognize my face. After 9 days of having bandages on, then dressing in a head wrap, and then wearing sunscreen and makeup to cover up, I finally decided to take off my bandages today. It feels strange to see my own face without bandages. It's like seeing someone else's face. And while I knew it would look different, it's still shocking. Not that I don't recognize myself, but rather I see my face through the eyes of others. Everyone always says you look so tired, and I thought, yeah, I am a bit tired. But actually, that's just how I look. Seeing my eyelids pulled tight and stretched over my eyes, no longer hiding the bags underneath. It's surreal. And this is probably the hardest part for me, the emotional part. As a side note, if you're finding this video helpful, please do me a favor and hit the like button. This helps to push the video out to a wider audience and lets YouTube know that this kind of content is valuable. Thank you. And now, let's get back to the video. I had a great visit with Dr. Yoon today. He checked out my incisions, asked me how I was feeling, and we talked about next steps. One question I had was, when can I start laser? What is safe? What is not? And what can I expect? So here's what he told me. He said he might use laser on day 13. So I did research and found that the only laser considered safe this early is the pulsed dye laser, or PDL. It reduces redness and inflammation in fresh scars. And studies show that early PDL leads to better long-term results. Dr. Yoon confirmed this. He said we might try a gentle PDL session on day 13, so stay tuned for that update. Here's what else I learned. Lasers generally work by vaporizing the top layer or layers of skin. This process helps improve texture, tone, fine lines, wrinkles, and scars. However, fresh surgical wounds are extremely fragile and sensitive. Applying laser energy to them can cause further damage, leading to worsened scarring and delayed healing. This is why my doctor strongly advised against using any ablative lasers like CO2 or erbium YAG at this stage. These lasers remove layers of skin and are too aggressive for my healing wounds. Same goes for fractional resurfacing. Even non-ablative fractional lasers, like the pixelated CO2 laser, which I love, are not recommended right now. They can also worsen scars or delay healing. So here's a quick summary of what's off the table for now. Avoid strong resurfacing lasers during early healing. That means no CO2, no erbium YAG, and no fractional resurfacing, at least for now. Let's talk about what I'm focusing on right now. Since surgery, my primary focus has been on wound care, rest, nutrition, and hydration. Eating a balanced diet rich in vitamins and minerals supports the healing process from within. Foods like lean protein, vitamin C, fruits and vegetables, and zinc-packed snacks help my body produce new collagen and repair tissues. Protein is essential for tissue repair. Think chicken, fish, beans, or lentils. Vitamin C supports collagen synthesis. So foods like bell peppers, broccoli, or strawberries are great options. Zinc aids in tissue regeneration. So snacks like almonds, pumpkin seeds, or yogurt are handy. Omega-3 fatty acids found in salmon or walnuts reduce inflammation and promote healing. Staying hydrated is also crucial. Water flushes toxins out of my system and keeps my skin healthy. Here's a list of the top healing nutrients and some quick ideas for incorporating them into your daily diet. Remember, small changes can make a big difference during the healing process. Next, let's talk about the under-eye laser. Is it safe to use laser under the eyes after surgery? My doctor also mentioned this to me. He said he might use laser under the eyes after surgery to help with any potential discoloration. This area is very delicate. Only gentle lasers like PDL are used early on, and eye protection is critical. Here's a quick breakdown. The skin under the eyes is thinner and more delicate than the rest of the face. It's prone to bruising and discoloration after surgery. Early laser treatment can help minimize this. However, traditional resurfacing lasers like CO2 or erbium YAG are too intense for the delicate under-eye skin. They can cause significant damage, worsen discoloration, and even affect vision if they get into the eyes. Non-ablative fractional lasers like the pixelated CO2 laser may be gentler, but are still not recommended immediately after surgery on the under-eye area. Pulsed dye laser, though, is a good choice for early under-eye laser treatment. It can help reduce redness and inflammation without causing excessive damage. Here are the key points. The under-eye area is delicate and needs gentle laser treatment. Eye protection is mandatory when performing any laser procedure near the eyes. Regular sunscreen use is also important for preventing further discoloration. And now for the moment you've been waiting for. What happens on day 13? Well, we're going to stick with the PDL. That's what's best for early healing. But you'll have to wait until my next video to see the results. Stay tuned for that. In the meantime, here's a quick preview of what to expect as we move forward. Day 13, we'll likely perform a gentle PDL session to reduce redness and support healing. After that, it's all about monitoring how the scars are healing, making any necessary adjustments, continuing with silicone gel, and keeping things clean. Long-term, I might consider fractional lasers. But that's a decision I'll make down the road based on how my scars are healing. Remember, patience is key, and rushing the healing process can sometimes do more harm than good. That's it for today's update. Thanks for watching. If you're healing too, you're not alone. I'll share more updates as this journey continues. In the meantime, take care and remember that you're doing better than you think. Healing takes time, but with every passing day, you're getting closer to your goals. Hey guys, I hope you're enjoying this content so far, and I hope you subscribed already. If you didn't do it, and if you did, watch this video right there. I think that will help you too.